My name is Ainul Farida binti Muhammad Taufik. My matrix number is 2024-214-326. Bye!
Hey guys, my name is Kisnina Humaira binti Muhammad Sayyidhan. My matrix number is 2024298768. Bye!
Hi, my name is Novelkis binti Muhammad Rosili. My student number is 2024273678. Bye!
Hi, and Assalamualaikum. My name is Alia Syahira binti Azali and my student number is 2024668328. Bye.
Hi everyone, my name is Aini Sofia binti Muhammad Kasim. My matric number is 2024217048. Bye.
Hi everyone, my name is Nur Adana Najwa binti Muhammad Mazlan Hamidi and my matrix number is 2024631208. Bye!
Covid-19 was first detected in Malaysia on January 25, 2020 with initial cases involving 3 Chinese nationals from Wuhan. The Ministry of Health quickly isolated these victims and took measures to control the spread. A significant outbreak followed a regional scattering at the Sri Petaling Mosque, leading to extensive transmission. In response, the government implemented a Movement Control Order (MCO) in mid-March 2020. The Ministry of Health (MOH) has led the country's response with measures including widespread testing, contact tracing, quarantine protocols and vaccination campaigns. The MOH continues to monitor the situation closely and provides regular updates through its COVID Now dashboard and other communication channels.
The next part of the introduction is planning. The first one is the concept of planning. Management first and most important responsibility is planning. Planning is then defining organization goals, developing a strategy to enhance those goals, and establish a thorough hierarchy of plan to integrate and coordinate activity. Planning is the most basic managerial responsibility. Next, the importance of planning is to reduce uncertainty and establish standards. What the planning done for managing the problem by ministry is the government intends to raise public awareness about these issues by organizing 3W and 3C campaign. 3W stands for Wash Your Hand, Wear a Face Mask and Be Warm, while 3C campaign stands us to avoid crowded place, close contact and confined spaces. MOH then release SOP instruction, P is because to help school and parents. Their instruction include checking mental health, giving counseling and doing safe activity for students. For short-term plan is reducing and adjusting the physical workplace. T is because to keep everyone safe and free from risk. Next, to campaign promote compliance with SOPs such as mask wearing and physical distancing. Long-term plan is to tackle COVID-19 on young people mental health is because the pandemic made many young people feel stressed and lonely. The plan includes support like counseling, program and activity to help them feel better. Next is to the digital and surveillance enhancement by introducing the My Sejahtera application for more efficient contact tracing and health monitoring. The objective to achieve is the government and the ministry involved must develop a more effective plan and improve the present plan for the people well-being. As a result, this will help reduce COVID-19 effectively. The party that involved doing planning is MOH and healthcare workers, National Security Council, private sector and NGO.
I will explain a little bit about the definition of organizing. Organizing is the way of work that is arranged and allocated among members of the organization so that the goals of organization can be effectively achieved. It includes identifying and grouping tasks, assigning roles and responsibilities, establishing relationships, and ensuring the proper allocation of resources to achieve the organization goal efficiently and effectively. Next is importance of organizing. Number 1 is to distribute workload to all organization members. Number 2, to improve the skill of organization members. Number 3, to encourage cooperation among the organization members. Now, I'll present about the strategy of MOH, which is Ministry of Health done for managing COVID-19 pandemic. Number 1 is Standard Operating Procedures (SOPS). This SOPS has been prescribed by the Director General of Health, and it is prescribed the mandatory measure to be carried out during daily activities. It applies to all individuals throughout Malaysia. One of 3 compliance that needs to be implemented is wearing a mask. All workers and individuals are required to wear a mask at all the time when they are outside, such as in a company or health facility. It is important to avoid infection to other people, especially to the individuals that have high risk to have COVID-19. Other than that, the strict compliance are physical distancing. All individuals must do physical distancing of at least 1 meter from each other. Next is movement control or the MCO. In terms of the health sector, it is subject to the rulings issued by MKN and MOH. There is a lot of protocols or activities that have been carried out. One of it are Protocol Health General. The brief description is the owner of premises ensure control of customers' entry and exit to the premises. The owner are required to provide Masejahtera QR code facilities and attendance registration book that are only allowed in the area of no internet coverage. Other than that is status monitoring employee health or officers. Employers must monitor and record the health status of employees every time they perform their duties. For example, screening body temperature or symptoms of COVID-19 at the beginning of work. Last one is home surveillance or the HSO. Individuals who are test positive for COVID-19 are encouraged to stay at home for 5 days. It is to avoid infecting other peoples. All systematic employees will receive HSO digital certificates. Did you guys know what is the difference between HSO and quarantine?
Hi! Now, I want to present on the decision made by the Ministry of Health MOH to prevent the spread of COVID-19. First of all, let me explain what decision making is. Decision making refers to the process of selecting a course of action or choosing between alternatives to achieve a specific goal or solve a problem. It involves identifying and evaluating options, considering potential outcomes, and selecting the most suitable option based on available information, preference, and desired outcomes. Now, let's address the question, what decisions have been made by the MOH to prevent the spread of COVID-19? 1. Declaration of Emergency and Movement Control Orders (MCO). The MOH implemented the Movement Control Orders (MCO) starting on March 18, 2020. This order restricted movement and gathering, closed non-essential businesses, and suspended school. The MCO was divided into 2 phases. Condition MCO (CMCO) allows certain economic activities to resume under 6 Standard Operating Procedure (SOP), and Recovering MCO (RMCO) focused on easing restriction while maintaining health guidelines. 2. Healthcare system response. Contact tracing and testing. Aggressive testing, contact tracing, and isolation measures were adopted. The Masejahtera app was introduced to assist in contact tracing and monitoring. Expansion of healthcare capacity. Temporary hospitals and quarantine centers were established to handle surges in case. Last is vaccination program. The MOH launched the National COVID-19 Immunization Program (PIC) in February 2021 with the goal of achieving herd immunity. Initiatives under this program include procuring vaccine from multiple sources, including Pfizer Biotech, Sinovac, and AstraZeneca.
Now, I will start talking about controlling of COVID-19. Before that, I would like to explain a little bit about controlling. What is controlling? Controlling is one of the fundamental management functions that includes monitoring and evaluating an organization's performance. In other words, it is a process of ensuring the activities are carried out in line with the plans of an organization. The importance of controlling. First, using resources effectively. By monitoring activities and comparing them with set standards, controlling helps to minimize wastage of resources. Second, achieving organizational objectives. Controlling emphasizes results rather than just activities. It ensures that the organization achieves its targets efficiently and effectively. Third, increase operational efficiency. Controlling identifies inefficiencies and redundancies in processes, enabling managers to optimize workflows and ensure smoother operations. Now, let's move to the how Ministry of Health controlled the situation during pandemic COVID-19. Ministry of Health MOH implemented a multi-phased approach to control the COVID-19. First, mask wearing. Ministry of Health obliging the wearing of masks, and it is compulsory among all Malaysian citizens to reduce the rate of widespread outbreaks, protecting vulnerable populations such as the elderly and immune-compromised individuals.
Therefore, with the emergence of more transmissible virus variants such as Delta and Omicron, the use of masks become more important, especially in crowded or poorly ventilated spaces such as shopping malls. Other than that, social distancing. The government has advised all citizens to practice social distancing between each other. COVID-19 is often spread through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. Keeping a safe distance reduces the chance of these droplets reaching others. We need to keep a distance of at least 1 meter from each other and avoid going to crowded places. Next, quarantine. The Malaysian Ministry of Health implemented strict quarantine measures to prevent the spread of the virus. People who are positive of COVID-19 must be quarantined for 7 days from the day they receive a positive result. Quarantine minimizes contact between potentially infected individuals and high-risk groups. My Sejahtera application was created by the government and used to deliver information about COVID-19. Lastly, restaurants can only provide takeaways. Government asked restaurants to provide only takeaway service. The goal of minimizing COVID-19 can be achieved by limiting indoor dining services. Only takeaway, delivery, drive-thru is allowed.
The Ministry of Health MOH in Malaysia adopted a strategic approach to manage the COVID-19 pandemic, focusing on planning, organisation, decision-making and control. Strengths like leadership, resource utilisation and collaboration enable rapid testing, contact tracing and vaccinations, though challenges such as resource gaps and communication issues persisted. Opportunities to enhance digital health and global partnership emerged, alongside threats like virus, variants and vaccine hesitancy. To strengthen future resilience, the MOH should improve infrastructure, communication and research while fostering international collaboration. These measures will better prepare Malaysia for future health crises.